Hello everyone and welcome back to my channel. I'm Dr. Daniel Follows and this is GP Made Easy. I hope you've all had an amazing week. So today I'm going to cover sinusitis because it's a common topic with the summer season coming up. And I'm going to cover both infective sinusitis and allergic rhinitis. And before I go ahead, don't forget to like, comment and subscribe so I know that you're enjoying this content. And stick around to the end of the video and you'll know more about the nasal sprays that are available over the counter and on prescription to help with patient care. So anyway, let's get on with the video. Before we begin, I thought I'd make you aware that sinusitis is also known as rhinosinusitis, so don't be alarmed if you hear either term used interchangeably. But what is it? Well, the definition is symptomatic inflammation of the mucosal lining of the paranasal sinuses and nasal cavity. Now, it has an acute and chronic phase. The acute phase is when they've had symptoms for less than 12 weeks, and the chronic phase is when they've had it greater than 12 weeks. Just to make you aware as well though, the chronic sinusitis patients can also have an acute on chronic phase if they have a sudden worsening from their baseline symptoms. So, what causes sinusitis? Well, the commonest cause is viruses, and these include rhinovirus, RSV, and influenza. Now, the risk factors that increase your risk of getting these viral type illnesses is smoking, if you have conditions which impair the ciliary function in your nose, such as cystic fibrosis or primary ciliary dyskinesia. Allergic rhinitis can increase the risk. Asthma can, cardiovascular disease can, diabetes can, and if they've got a tumour in their nose, that can increase the risk. Now, the other cause is bacteria, and the commonest bacteria that can cause it, I will put on this side of the screen so you can have a read for yourselves, as they can be quite tricky to pronounce. And again, the risk factors that put your risk of bacterial infections include if you've had any dental procedures or infections recently, if you've had any recent procedures near the area, such as sinus surgery, NG tubes, any nasal packing, and if they've been on any mechanical ventilation, if they have a condition that weakens their immune system, such as HIV, impaired ciliary function, just like for viruses, and if there has been any obstruction near the area, such as a deviated septum, foreign body, a nasal polyp, or a tumour. Now, both these causes are the same for both the acute and chronic phase of sinusitis. And why do we care about it so much? Well, it is estimated that about 2 to 10% of primary care presentations will be to do with sinus issues. So, how might someone present? Well, some of the commonest symptoms they'll come with is a runny nose, feeling like their nose is blocked. They may sometimes as well say that their face feels full because of the sinuses being blocked. They may also come with a headache as well, with how close the sinuses are to the brain, causing a headache. They may also present with what's called a postnasal drip, where they'll say they get a constant feeling of something running down the back of their throat. And of course, because the nose is the sense of smell, they may also come with a decreased sense of smell. When examining the patient, you may see obvious discharge coming from their nose. When you press around their face, especially here and here, they may complain that it's quite tender there. And if you do end up having a look in their ears, their tympanic membranes might be bulging because of the back pressure from the nose. Now, part of examination as well is, what some people do is they'll put their otoscope up the nose and have a look up the nose, and you may see a polyp, which looks like this. They may just see inflammation in the nose, or they may find sinister signs of a tumour. You may also see signs of a deviated septum. Now, the guidance recommends that you need at least 3 or more of the following symptoms for it to be classed as a bacterial infection. So they are, if they've had symptoms for more than 10 days, if there's quite offensive, discoloured or purulent discharge, if they have a fever, especially if it's above 38 degrees Celsius, or if they've had marked deterioration since when you last saw them. So, how do we treat sinusitis? Well, if you have a patient that you suspect it's a viral cause, then the main things are paracetamol and ibuprofen for the pain, and to help with the blocked sinuses they can get over the counter either nasal saline or a decongestant such as Otrivine, which has the active ingredient xylometolazine. Now, if they come back to you and say none of these treatments have worked, it's still there or it's getting worse, if they still don't meet the criteria for bacterial infection, then you can move on to give them a 14-day course of an intranasal corticosteroid such as fluticasone or mometasone. Just a heads up, the guidance does recommend that you can increase mometasone up to 200 micrograms twice a day, which is 4 puffs twice a day, but this is an off-label use. Now, if you suspect a bacterial cause, then the treatment would be antibiotics, and the first line is phenoxymethylpenicillin, which you give a 5-day course. If they're allergic or can't tolerate penicillin, then the alternative choices are doxycycline or clarithromycin, or if they're pregnant, then go for erythromycin. If they deteriorate while on the antibiotic, then the next line would be to bump them up to coamoxiclav. If you had to start them off initially on the second line choices, then the guidance recommends you discuss with a microbiologist which ones to use next. Now, the guidance makes it very clear as well that if you're treating a bacterial cause, to not give any intranasal steroids while they're having treatment. Now, they are all the treatments for acute sinusitis, but what if they have chronic sinusitis? Well, then the treatments for that is, number one, the biggest thing is nasal irrigation with saline. I'll tag a link down below for a video showing how to do that type of process. And you can also give them a 3-month course of the intranasal steroids instead. Or if they come to you, they've started the treatment, they said it's not made any difference or they've got worse, then you can add a nasal decongestant in as well. And of course, if after the 3 months of treatment, if they've not made any improvement, then you refer them on to see an ear, nose and throat specialist. Just remember, if there are any red flag symptoms, especially persistent unilateral symptoms, or you see a sinister feature while on examination looking like a tumour, then don't forget to refer them on a 2-week wait referral. So that's infective causes of sinusitis covered. We're now going to move on to allergic rhinitis. So this is just inflammation of the nose. It's just isolated to the nose. So they'll most commonly present with sort of a running, blocked nose, sneezing as well. And what's different in the history is you will get quite clear trigger type symptoms, such as when they're around grass or around lots of plants or near pets. So the first line treatment is intranasal steroids. Now the difference with this is if they don't want to keep coming for prescriptions, you can recommend them over the counter Beckinase, and then if that doesn't work, you can step it up to the fluticasone or mometasone. If that doesn't work, then you can swap it for an intranasal antihistamine such as azolastine, and even if that doesn't work, you can do a joint nasal spray that has the antihistamine and steroid in it as well. And if symptoms are really severe, you can give them a short course of oral steroids for 5 to 10 days. And the dosing for that is 0.5 milligrams per kilogram. So obviously I've been discussing all about the nasal sprays available, but what is the correct technique so patients use them effectively? Well, I've got my little nasal spray bottle here, as you can see, and I'm going to do a little demonstration. So I'm going to talk through it first, and then I am actually going to use it as well. So with the patient, you've discussed about why you're giving them the nasal spray. You show, if you do have a dummy bottle there, you can show them, or if not, I tend to use a pen and just make it like a little fake bottle. So you get them to shake it slightly just to mix up the medicine that's in there. Get them to remove the cap, and then they have to be sat up straight while doing this. They want to be sat up with the head slightly bent forward. And a lot of patients will end up going straight up with the spray, but how they actually need to do it is to be going backwards. So they go back, angle it slightly out, and do one spray, and then they let it sit there for about 15 to 30 seconds. If they need to do a sniff, just tell them to do a very light one, because if they feel it go to the back of their throat, then it's gone from the area where it's supposed to work. And then if they need to do 2 sprays, they would then repeat it all again. So obviously with this, so shake it. So I'm sat up straight, head slightly forward, going to the back of the nose, slightly out, and then spray. And then let it sit there like that for about 15 to 30 seconds, and obviously not sniffing too much so it doesn't go to the back of the throat. And that's the technique that you can show to patients. I'll also drop a link in the description to this video, which has another video that you can show to patients about the nasal spray technique. So that's it for today's video. I hope you've enjoyed it. And as I promised at the beginning of the video, these are the nasal sprays that you can buy over the counter, and these are the nasal sprays that are available on prescription. Don't forget to like, comment and subscribe. Lets me know that you're enjoying this content, and if there is anything that you would like me to cover, then please comment down below and I'll pick it up and make future videos on your suggestions. I'm also on Instagram, so don't forget to follow me on there. It's the same name, it's GP Made Easy, just up here. I'll also, in the description again below, I will put all the links for all the guidelines I've used and all the resources for the videos and anything else I've used. But anyway, I hope you guys have an amazing week, and I will see you in the next video.